नंतर तसं कोणी भेटायला नाही. अरे सेंटर काय नाही. तेव्हा त्याने खूप सांभाळलं.
तो लॅपटॉप लागेपर्यंत माझ्या काही दिवस नाही लागणार. तिथे कोणती अनुपमा असेल तिथे फोनवर बोला. हो गया ना सबको बाहर खड़े हाँ पर ऐड आप ही हो सकता है ब्रेकफास्ट लंच सब एक साथ अभी तो आगे सबके अच्छा अभी तो डेढ़ पासून म्हणजे किती 10-15 मिनिटं मॅडम ना जरा रिक्वेस्ट करा ना पण बरं You came from किती 10 मिनिटं
लाईव्ह केला आणि शेअर केला आता
आमचे लोक दाद नाही ऑफिसमध्ये आम्ही जायची वेळ आली त्यावेळेला बेंजामिन सर योगी कसे करतात आपण बेंजामिन सरांनी बंद केला आणि क्लिअर झालं मी जाऊन नंबर आहे का तुमच्याकडे रुईला सांगितलं काल घरी आले होते त्यांना म्हटलं बा असं असं आहे त्यांची इच्छा आहे
तू येणार मेरा कॉल होता बाकी कॉल मध्ये होता कॉल पे तुम्ही जाते
तुम्हाला ते आणून छान
ये गाड़ी भी नहीं है।
अंदर
गाड़ी आएंगे अंदर, लेकिन उनको
बाजूला उलट गाडी आणताय.
ये गाड़ी भी नहीं है।
नमस्कार. आपला सेंटर आहे. सेंटर.
फ्रंट लाइन
मोबाईल पण माझ्या कॅमेऱ्याला पुढे घेऊन जाऊ.
फोटो टाकता येईल. कॉन्सेप्ट आयडिया थोड़ा बीच में टाइम लगा बट I hope you have more time to meet them. Yes, yes. Please. Please have a then.
इकडे या साईडला या साईडला
हो, इथं आपण हे झालं. आता आपण हे रजिस्टर घेतला. म्हणजे पुढे काय मग ते सगळं आपण तुम्हाला लास्ट जर इथे दाखवून रिसॉर्टला आपलं पुढचं पाणी अच्छा ये करायचं
इकडे इकडे मॅडम मॅडम इथे
सर एक मिनिट.
वेट 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 वेट
हाँ yes, center. This is my conference room, which we have between. Part of IFMR.
Yes.
Yes.
DHR.
Department of
तो आप रिसर्च करेंगे
But this is specific diseases study. Problems. We work closely with the district. Yeah, madam. कहाँ पर है? हमारे डॉक्टर राहुल वैसे
ये वाली सबसे फर्स्ट
आणि तोपर्यंत खाली आणि स्वीट
इकडे जायचं मागे आपलं नागपूर ते नारळ पडलं ना मला वाईट मिळणार वेट सर ठीक आहे सर इथे बाजूला
एक सेकंड मी जरा इकडे जातो एक सेकंड बस आप आओ सर आ जाओ
सर
ले ट्राय कर असू दे लाईन आता
सगळ्यांना वाटून
सर त्या घेतो सर सर स्वीट
योगेश नाटक
योगेश
पाणी आहे
आराम से सब पीछे
लोगों का लोग भी आएंगे उनका ट्रीटमेंट प्रोजेक्ट में
Yes. इनके रिकमेंडेशन से हमने हमारे डॉग को लिया तो 15 के रिवर्स लिया तो उसके
अच्छा तो
सोलिबिलिटी करना है सोलिबिलिटी के बाद ठीक टेस्ट उसका कंफर्मेशन इसमें वो मिल गया थैलेसीमिया है और सिकल सेल ये मैंने प्रपोज किया इसका डेमो उन्होंने तुमको प्रपोज किया
एक प्रोजेक्ट भी चल रहा है जिसमें हम इसको गोल्ड स्टैंडर्ड जो हमारा HPLC मशीन है दैट वी हैव वर्कड विद प्रोजेक्ट एंड सबसे दैट इज वेरी कॉस्टली वी आर कंपेयरिंग दिस विद द गोल्ड स्टैंडर्ड एंड कंपैरिजन कंपेयर हम ईपीएल
बहुत सारा क्लिनिकल साइड भी लगता है
तो अगर ट्रेनिंग सिंपल प्लस
ये जो पेरिफेरल से नहीं करना
हां
उसके आगे का हम यहाँ पे बाद में बहुत सारा डिपार्टमेंट्स का भी इसे हेल्प करता है हमारे पास स्पेशलिस्ट होते नहीं सो अगर हम ऐसा कुछ एक टाई अप कर पाए थ्री मतलब ऑल द थ्री पार्टीज DHO साइड देन योर रिसर्च साइड एंड मे बी JL so I think that
that part ma'am they can help us just for training treatment capacity building and for further assessment of the patient. They can
इनफैक्ट हम ट्रीटमेंट का भी हम ऐसा कर सकते हैं कि अगर जैसे लोग यहाँ पे उनसे लोगों को जाना मुश्किल रहेगा तो अगर स्पेशलिस्ट आ जाए देन हम उस टाइप का थोड़ा देन दे विल बी आल्सो गेटिंग अ पॉइंट
Hospitals we have a monthly OPD of IIB and district people, SDH people, and we are also doing the forward follow-up of simple scientific meeting. But every month we are
हमें बैक वाला भी पर्सन चाहिए होता है, किडनी वाला भी आगे स्पेशलिस्ट चाहिए होता है, तो बहुत बार हम रूटीन बेसिक तो कर पाते हैं बट थोड़ा स्पेशलाइज्ड है
तो उसमें वो भी है मैम, but we also add on, I mean, the advice where hematologist also comes that CTC borrelia.
that's once in a month यहाँ पे only
SDH में
yes stage so maybe अगर वही हम expand कर पाए
स्टेज में अगर हम कैपेसिटी बिल्ड करते हैं और इनके कोई मेथोडोलॉजी से कराएंगे तो भी अच्छा होगा। फ्यूचर में एवरी टाइम दी नॉट टॉक बट आपने डॉक्टर्स भी
मतलब हम एक साइक्लिंग कर सकते हैं तालुका लेवल पे जैसे एसपीएच अलग अलग रोटेट करते हैं
आरएचएसडी
क्योंकि मेन प्रॉब्लम रेफरल ट्रांसपोर्ट का है वो लोग इतना दूर नहीं आ पाते हैं सो अगर वहां तक पहुंचा पाए एंड जो पेशेंट है अगर उनका डिटेल जैसे अपन एमसीएच ट्रैकिंग करते हैं वैसा अगर इनका एक ट्रैकिंग सिस्टम बना
एक आईसी पर आपको पर्सन से ना
हां also can be done right
It's going all the way
डिफिकल्ट तो अगर वो पीएचसी में भी एक दिन निश्चित करके दिया तो पीएचसी में बल्कि अभी जो स्मार्ट
सेंटर से
ऐसा कुछ बता रहे हम अभी क्या करते हैं स्क्रीनिंग करते हैं हम उसके आगे का ट्रीटमेंट पे इन लोगों का और उसका ट्रीटमेंट बड़ा मल्टी फेसेटेड है जो डायग्नोज कर दिया सिर्फ उस पे नहीं रुकता है उनका क्वालिटी ऑफ लाइफ इंप्रूवमेंट भी हम क्या कर सकते हैं
ऐसे हमारा रिकमेंडेड प्रोजेक्ट्स हमने अडॉप्ट किया ये तो था
डायग्नोसिस
बिना मैडम स्टेट ने डिनाई किया था अंडर प्रोजेक्ट लेकिन हमने हमारे फंड से एक्सटेंड किया था एक बार आपने हमने इस बार सो व्हाटएवर एस्पिरेशन टॉप के लिए हमने
वो एक
प्रपोजल से जो इम्प्लीमेंट किया ना इनकी तो इम्प्लीमेंटेशन
बड़ा प्रपोजल है मैं यही चाहती थी कि उसको ही हम अगर ऐसा कर पाए मतलब डिलीनिएट कर वो भी प्रपोजल दैट वुड गिव अस ऑफ एंड अपडेट्स हियर ना बट उसमें ना शुरुआत से लेकर एंड तक हम अगर आउटकम मॉनिटर कर पाएंगे ना तो अच्छा रहेगा तो इंस्टेड ऑफ जस्ट डायग्नोजिंग एंड लीविंग इट देयर
तो हमने कहा केस स्टडी थी वो भी है ना हमने उसको दिया
CM में सिंगल में the positive अच्छा that yes
but there
मॅडम पुढे पुढल्या
HCM आप किसको बोल रहे हैं शॉर्ट फॉर्म में क्या
की जगह
HCM
this government we are the
बहुत स्टाफ हो गया है ये एक्चुअली
they are supporting us very nicely thank you very much for everything
पॉसिबिलिटी
पुढे वा
हमें सपोर्ट अपना सिविल हॉस्पिटल में चाहिए वो बन जाएगा ना तो एक
वैसे भी डिस्ट्रिक्ट सेंटिनल
आ जाएगा हां
that side will have
actually leprosy was very concerning abhi recently
we were the first to establish this COVID-19 diagnostic facility. Okay. So when we were in that crucial period of pandemic 2020, so
this was the last that we had
COVID.
we have a project on daily work, so we will be doing daily.
Right, that time, we supported a lot for the Shiva in the center of and doctors. Now, I know, for and continue there. We have purpose there, but we are continuing. Okay,
Regarding molecular diagnosis, ma'am, even recently had the request from the state that the anti-malarial facility will be super leprosy. So that's
So actually in the last meeting that told me कि leprosy अपने यहाँ पे rise बढ़ रहा है.
चिकन भी बहुत ज्यादा बढ़ रहा है.
So maybe what all measures we can take वो हम लोगों को एक next meeting में. Okay. When the next meeting is there, maybe we will invite you also and we discuss that.
Then we leave for.
Yes, yes, yes. चलेगा.
तो ये नया रूप
We are very happy to know that.
Yeah, I know it.
I'm amongst academia, तो मुझे भी बहुत रहता है. Let's work somewhere.
Yeah, -20 also. So it look like they're planning out to be -20 also. Because we have idea. What things that are that's wrong.
ठीक है सर, चलूंगी.
Still higher than और मैडम उधर सर या नहीं ग्रुप फोटो का
हो गई.
Yes, multiple ideas to start. If we can plan some things. Yeah. But not anyone of us can direct
बंद करो.
Maharashtra State Health Department, and also Grant Medical College, JW Hospital. I extend a very warm welcome to you all to this very, very special event, which marks the completion of 10 years, and I would say 10 successful years of model rural infrastructure. Those who are not from ICMR are DHR. MRHRU is a centrally sponsored scheme which had been launched by Department of Health Research, Ministry of Health and Family Welfare. As of now, India has approximately 38 MRHRU across different states of India. And the objective of this scheme was to strengthen health research infrastructure, especially for the benefit of rural and tribal population in India. And I will tell you that MRHRU Dahanu was the first MRHRU which was established by DHR in Maharashtra. And I'm happy to share that 2 more MRHRUs are being established, one in Mani, Nashik, another one in Maikar, Buldana. And when I see the audience, I really feel happy and encouraged. I'm sure most of you have traveled more than 3 to 5 hours on road to be here. I think distance was a big deterrent for most of the people who wanted to join, but they stopped short of joining this event. So your presence here, it really reflects your support and commitment to the cause that defines the existence of MRHRU. If you can summarize the essence of MRHRU, it can be described in 3 words: Samvedna, Sayog, and Samarthya. Samvedna or sensitivity to the needs of underprivileged and underserved population. And Sayog, I don't think we can have better example as compared to MRHRU. This is the best example of intersectoral collaboration. We have ICMR DHR, we have State Health Department, we have medical colleges, we have community workers, healthcare workers, and also many experts which work at government and non-government organizations. And coming to Samarthya, according to me, Samarthya are capabilities that means finding solutions for difficult problems, solutions which work, which are affordable, which are acceptable for rural and tribal population. So this in brief sums up the very idea of MRHRU. And I think it has been said that to fulfill your vision, you should have hindsight, you should have insight, and you should also have foresight. And I think we are privileged that our former Director General and Secretary Government of India, Dr. B.M. Katoch, he had good combination of all 3 attributes. So it was his brainchild that these MRHRUs were established. And we really thank you, sir, for being with us. It's really an honor. You started this, now I started into a 10-year-old baby. I think it has a lot of scope to grow further. The childhood has been great. And successors of Dr. Katoch, sir, they have also been very, very supportive. Dr. Soumya Swaminathan, then Dr. Balram Bhagar, and our current DG, Dr. Rajiv Behar. They are fully supportive of this scheme. In fact, Dr. Rajiv Behar is striving hard to broaden the scope of these units. Recently, we had a National Health Research Priority Projects plan for these MRHRUs, especially on anemia reduction and also on screening of common cancer. And he's also driving a very ambitious population-based health survey, which would be like annual survey to assess changes in trends and patterns of existing and emerging problems in rural and tribal population. Besides that, these units would also be roped in the clinical trial network so that there can be more clinical trials. And in addition to that, these sites would also be the sites for technology validation. I think the whole idea is that the needs and responses of our rural and tribal populations, they are taken into program when we are defining or designing new policy and programs. So this was about the support we have been receiving. Now I will talk a little bit about MRHR in Damhan especially. The journey hasn't been very smooth. There have been ups and downs, and there were challenges. Challenges in establishing the unit and also in setting up the unit. Geography, distance from administrative hub, then treatment like issues regarding maintaining equipment, procuring equipment. But these challenges were not something which we didn't anticipate. These challenges were anticipated and we were ready for that. But what really worked for us was a very generous support from state health. So I would really like to thank all state health officials and everybody who activities supporting the unit. Specifically, Dr. Hindu's presence here itself is a testimony of state support to our unit. Thank you so much, ma'am. You have been so busy, but still you accepted our invitation to be with us. Thanks a lot. Then Dr. Vipul Vinayak, Secretary Public Health, Dr. Nitin Ambadkar, and then, sorry, I'm forgetting some names. And even in district health level, Dr. Santosh Chaudhary, Dr. Maharaj sir. So thank you so much for Dr. Bhavre. I think your presence really adds value to the proceeding of this meeting. So thank you for your presence. And we hope that the support from state health would continue in the future also. Thank you so much. And when you are speaking about Nahanu, I think we must credit our previous directors, Dr. Sanjeeva Korpute, had given his time when he started through the giving, and Dr. Mahale. During that time, we completed the construction of this meeting. So we are really glad to have you both with us. Thank you so much. I'm coming to that. So thank you, ma'am. And because during Madam's time, we started so many new projects, like on elimination of snake bites and multi-component nutrition and hemoglobin balance. And these projects have really taken shape now. Thank you, Dr. Korpute. Thank you, Dr. Mahale, for your presence today. And now coming to our project teams. I think I was talking about challenges, there have been challenges, but our nodal officer, Dr. Chauhan, the first nodal officer, we got instrumental in setting up this facility along with very able support from Dr. Rahul HTA. I think they actually have set the stage for us. And so that's why it became a little easy for us because of you two. Thank you for taking up the challenge, Dr. Chauhan. Thank you so much, Dr. Rahul. So, and finally, I would also like to thank our LRSC members, local research advisory committee members. They have been giving us sort of cerebral support, intellectual support. Dr. Kiran Katoshna, somebody who had actual compassion for underserved people. And she had been guiding us when we were setting up on new programs. So thank you, ma'am. Thank you so much. Dr. Sanjay Mendle. He was also the member of IPIP consulting of our institute's activity as well as MRHR activity. Thank you, Dr. Mendle, for being an excellent guide and very, very supporting faculty to us. Thank you so much. And now I would just say that this symposium, I was talking about MRHR in Nahanu, but this symposium is not just about celebrating 10 years of Nahanu. We also want to learn from other MRHRs, and that would be happening tomorrow and day after tomorrow. There would be many opportunities to learn from others' successes and failures. And I'm hoping that this symposium, where there will be more participation from researchers from MRHRU, other MRHRUs, and also other agencies which are working in the area of tribal health research. So we would have a number of opportunities to learn And I'm hoping that this symposium would come up with some recommendations for identifying identifying ways to do research in a better way and also to identify some priority areas. So thank you so much, and I wish you all very, very stimulating another 1.5 day. Thank you so much.
Thank you, ma'am.
Thank you, sir, for your enlightening address and paving the way for rural and tribal health research. May I now request Director Dr. Gitanjali Sachdeva ma'am, Dr. Katoch sir, and Dr. Ragini Kulkarni to felicitate Honorable Collector ma'am, Dr. Indurani Zakar. Director ma'am is presenting a mother and child memento, which is depicting mother and child bond, representing well-being of a mother and child, aligning with the mandate of our institute. So this is a tarpa which Ragini ma'am is presenting. So it is a traditional instrument of tribal communities, aligning with the. Thank you, ma'am. So now we move on to the next important segment of today's program, which is release of MRHRU Dahanu video. So may I request Honorable Collector ma'am, Dr. Indurani Dakar ma'am, to kindly do the honors.
स्क्रीन करा पड़ते
Next, we move on to release of some of the information education materials which has been developed by our team by Honorable Collector Ma'am Dr. Indurani Zakhar Ma'am. So first IC material is IYCF recipe booklet. So ma'am, may I request you to release this IC material which is on nutrition recipes for infants and young children. I would also like to invite Ragini ma'am, Dr. Shraddha. This has been developed by our team as a part of an ongoing project of ICMR. So this booklet can be used by Ashas and Anganwadi workers to explain about the nutrition recipes, especially using locally available food, which can also be adapted at Anganwadi. Thank you, ma'am. So the next IC material is on preconception care. May I now request you to release IC on preconception care? I invite Dr. Beena Joshi, ma'am, Dr. Ragini Kulkarni, and Dr. Purvi, the research team who have developed this material as a part of our ICMR funded project, which is being implemented in Thane and Mumbai, under which this material has been developed. As we all know, preconception care is an important component in the continuum of care from adolescence to pregnancy, and this information education material could be used again by ASHAs and ANMs to provide information on PCC, and could also be adopted by state-run Vatsalya program. Thank you. So I now request Chief Guest, ma'am, Dr. Indurani Jakhar, ma'am, to hand over. We have one package consisting of preconception care modalities, which contains information and prophylactic PCC commodities to a newly married couple who is present among us. I invite Mr. and Mrs. Lata and Asha Cole, who reside in Golwar area, and I request ma'am to offer this small bag through the traditional Maharashtrian ritual, which is called as Oti Bharne, which represents coconut and rice grains as a symbol of good health and prosperity for completeness. It also contains Haldi Kumku, which is a sindoor for long married life, and along with other commodities to remain healthy and plan pregnancy whenever they desire, and emphasizing especially the role of husband to be a responsible partner. Thank you, ma'am. So the next segment of IC is about creating cancer awareness. I now request ma'am to release this IC on cancer awareness. May I now invite Dr. Shahina ma'am, Dr. Anushri, Dr. Kiran is already there, Dr. Mahadev, Dr. Ranjan. Please come on the dais for joining this inauguration, which is also developed during the part of the ongoing research team. And this can also be used by medical officers, ASHAs, ANMs for creating awareness in community regarding oral, breast, and cervical cancer screening. I also request Anamika if she is in the crowd. Please join. Thank you, ma'am, and thank you, everyone. May I now invite Dr. Beena Joshi, ma'am, Scientist G and Head Department of Operational and Implementation Research, to introduce our Honorable Collector, Madam, Dr. Indurani Jakhar, ma'am.
A very good afternoon to one and all. It's my proud privilege to introduce our chief guest for today's function, Dr. Indurani Jakhar, IAS 2016 batch. She's a medical graduate with a master's in public administration from JNU Delhi and has served for more than 7 years in public service. She was the subdivisional magistrate and project officer of Integrated Tribal Development Program at Gadchiroli, where she focused on livelihood development of indigenous population. She was also the chief executive officer Zilla Parishad Ratnagiri, and her contributions during COVID time were immense to strengthen the health system to address COVID pandemic. She has been the managing director of Mahila Arthik Vikas Mandal, which supports the tribal and rural communities for better incomes from livelihoods. She has also been the Commissioner of Kalyan Dombivli Municipal Corporation, contributing immensely to the Smart City project out of the many state schemes. And she's currently Collector Palghar District. Madam, may I request you to give your inaugural address?
Respected dignitaries of the dais and all the participating members. Very good evening to everyone. First of all, I would like to thank Dr. Ragini for inviting me here. Being a medical graduate, it's been a long time for me that I've attended a symposium, and you've given me the privilege of attending one, despite having moved from there towards the administration side. I think it is a great pleasure to come here. Particularly, I was very delighted and happy to see the coordination between the center, uh, which is a part of central government, and our state government officials. So many a times, being a research institute, there is a participation, or there is a collaboration with the medical college. Like Pradeshi Madam is there from JJ. But district administration and a central government agency working in a district coordinating so well with each other is an exception. So I would really like to congratulate all of you that you have brought out this coordination so well. One of the most important aspects is that हम लोगों ने research किया है. We have made some wonderful IC material, but then it has to reach the last person who is delivering the service. Like we just saw that this lady was talking about how the nutritious recipes they have planned it for the people, and now they've also taught the mothers how to make it. So probably this is the actual need, like research we are doing, but extension of those research to the needy people, to the person who will be implementing it. So I feel in a way we have achieved it a little bit, and probably will go further and ensure that whatever efforts have been undertaken by you all, they reach the last person. Uh, I would like to also congratulate the team of the center, the Model Rural Health Research Unit Tahanu, which is part of the NIRRCH. So it's a unit of ICMR. I got to know today itself in detail. I had a brief idea before coming here. It's a privilege for us that such an institute exists in our district, and we would definitely try how much advantage we can take out of this institute for the people of Palghar, to probably augment the capacities of our staff, probably find out the solutions to the unique problems that exist in the tribal population particularly. All the material that we have published today is of immense importance to the people. For example, the recipes that we have talked about, or cancer screening. We were discussing that this priority program for prevention of anemia and treatment of anemia has already been taken up by the health and research unit. So we would try that we take this work further, and probably even diversify it a little more, as we discussed with respect to the sickle cell anemia. You're already working on that kit and everything. So we would really appreciate if we can work together further. Our DHO and civil surgeon both are here, and I've already we discussed how to take this thing further and probably enrich the experiences of both of our sides. Right now, we are talking more about research or diagnosis, maybe towards the treatment part also, how we can take it. I'm in the end extremely happy once again that I could be part of this gathering. I could get a chance to meet all of you, and my best wishes for the symposium. I saw the list and it has very good, very diverse topics. Uh, I see that we have also invited people from other health centers to share their experiences and success stories. Our team will be here, and I would be very delighted to know of any of the things that we could replicate in the district so as to help for the betterment of the people. Thank you for calling me here. It was an honor being here. Thank you so much.
Thank you, ma'am, for your insightful address and encouragement. Thank you, ma'am. नहीं May I now invite Dr. Ragini Kulkarni, Nodal Officer, ICMR, NRRCH, MRH, Chariu Dahanu, to give an overview of the journey and significance of the decennial milestone.
Good afternoon, all. Respected dignitaries on the dais and off the dais, all the senior colleagues and my dear friends. I will give a very short overview of, in brief, about our Model Rural Health Research Unit Dahanu and about the decennial celebrations. So we have already seen the video and heard before. The stage is already set. So we have this MRHRU Dahanu decennial celebrations because we had established this in 2014, which became functional in 2015, and we are now celebrating completion of 10 years since its establishment. So these are the decennial celebrations. This is a tripartite partnership, MRHRU, between ICMR, NIRRCH, our institute as a research and mentoring institute, Directorate of Health Services as a facilitator, and Grant Medical College and JJ Hospital as for research and translation. So, MRHRU Dahanu, we have officials from the State Public Health Department, including Director Health Services, Civil Surgeon, District Health Officer, District RCH Officer, and Medical Superintendents. In our institute, we have Dr. Gitanjali ma'am, our director, myself, and Dr. Kiran Munne as member secretary. And we have Dean and Nodal Officer, Dr. Geeta Pardesi from the Linked Medical College. So coming to the MRHRU Dahanu, if you look at the human resources and the activities, we have core staff of MRHRU, 10 staff, which includes a scientist C, non-medical. We have project technical support, 3, lab, 2 people. Then we have medical social worker, field investigator, admin person, field workers, 4, and we have a multitasking staff. So this is the core MRHRU staff which has been funded by the Department of Health Research. Plus, we are very glad to share with you that we have lot of almost 9 to 10 extramurally funded projects which are currently being implemented, and a total of around 51 staff which is working at MRHRU Dahanu currently in the ongoing projects. So just to give a glimpse of what all activities we are doing, we are, as I just now said, we have research projects which are 9 to 10 now. Then we have diagnostic facilities and we have capacity building activities. So I would just tell you about some completed projects in brief, that what are the overall significant achievements. And Collector ma'am just now said, like, we are working very closely with the district health system. So how we have supported the district and the state health programs, that I would just give a glimpse. The first example was the project on snake bite, which Dr. Rahul Gajbia had actually implemented when he was at Dahanu. So this is a multidisciplinary model for addressing burden of snake bites in rural India through health system capacity building. And tomorrow we have a presentation from him, how he has taken this from the Dahanu model to national level also. So we have the policy brief and we have trained all the medical officers in Palghar district through this project when he was there. Then another project which we did was on intervention project on nutrition, which was an ICMR task force study. What important part, just to give a glimpse, what we could do is we could reduce the MAM and SAM children, that is moderate acute malnutrition and severe acute malnutrition, among the under 5 children. And most important part, what we thought in this innovative part was demonstration of recipes, low-cost nutritional recipes, in which Dr. Suchitra Surve, being pediatrician, played a very important role in this project. And we could reduce the MAM and SAM in this through this particular project because through the pre and the post intervention survey. So this model could be implemented now in other tribal areas for improving the nutritional status of adolescent girls and under 5 children. Then we have the integrated measles and rubella vaccination study, the multi-center study. I would really like to thank Dr. Sanjay Mahendra sir because he was there at that time when we implemented this IMR study. We developed the protocol along with him. This was a multi-center study. And this study was very important because it gave valuable inputs to the measles rubella vaccination campaign of Government of India. So the pre-campaign survey we had done and post-campaign survey, which actually showed the improvement in the immune status of the under 5 children. Then the next project which we did was the birth defect surveillance project, which was actually conceptualized when Dr. Sanjay Chavan was a nodal officer. And it was a very important project which gave very good support to the district health system. It strengthened the linkages with Rashtriya Bal Swasthya Karyakram, that is RBSK program. It developed innovative IEC material on birth defects. Training of ASHA workers was done, and this training actually improved the reporting of birth defects by the ASHAs. So this was on community-based birth defect project. Then we have another project on non-communicable disease, NCDs and common cancers, wherein Dr. Anushri Patil and Dr. Kiran Munne, they have worked for this project. And in this, they have trained the MOs and ANMs from PHCs and also from the sub-district hospital Dahanu. They have given training on cervical, oral and breast cancer screening. Then we had another very important project by our department head, Dr. Bina Joshi, management of severe iron deficiency anemia in pregnancy. So this was about ferric carboxymaltose. And this was comparison of iron sucrose and ferric carboxymaltose, showing the cost effectiveness of ferric carboxymaltose. So the study demonstrated that IV ferric carboxymaltose, it is safe and acceptable. Hence, FCM can be used for management of pregnant women with anemia. The policy brief was prepared in February 2004. Tomorrow again, we have a presentation by Dr. Bina Joshi, wherein she would be telling not only about this project, but also about the cost effectiveness and the HTA components, what all they are working on. Then we have project on neonatal screening approaches for sickle cell disease. Dr. Harpreet Kaur ma'am is here. She led this study and we have just completed this study, multi-center study, a 5-year study in which Dhanu was one of the centers. And very important findings came out of this project. We did the newborn screening for sickle cell anemia through this project. We are glad to share that we have shared all the data of this project with the district officials. Around 7,000 children, newborn children, we have screened. I'll not go into the details of the data as such, but we have built a cohort of sickle cell disease babies, also carriers. And this all data is shared with the district and the state health officials. A very important part which came out of this project is that along with the IAP, Indian Academy of Pediatrics, and the CTC Comprehensive Treatment Center at Borivali, we have we have actually established a hematology OPD at Sub-District Hospital in Dahanu, just across our MRHRU, wherein what we are doing is whatever cohort of sickle cell disease babies we have identified, around 40 babies, we are not leaving them up, we are following them up. And every month we are doing checkup of these babies through specialists at the sub-district hospital. So this is again a very good example wherein we have not stopped at the end of the project. We are working with the district health system and these babies are called every month and we are doing follow-up at the sub-district hospital Dahanu for the management of sickle cell disease. So this is being followed up and also we had very innovative IEC material developed. We had a dissemination meeting also of this project in November 2024 wherein we had released this IEC material, especially for the genetic inheritance part, how diagrammatically and in simple language can explain to the people how this is being inherited disease. Then ongoing projects, this was all about the completed project. In short, the salient projects, I would say. Now I would go on to the ongoing projects which we have. So in maternal and child health, we have a project on validation of novel serum biomarkers in prediction of early onset preeclampsia among pregnant women and correlation with maternal and neonatal outcomes in a tribal district of Palghar. So along with me, Dr. Taruna Madan from now, she is in headquarters. She had conceptualized this project. And what we are doing is we are taking blood from first trimester women and then we are following them up, how many of them develop preeclampsia, and then seeing their neonatal outcomes, so that if we identify early, that is the risk for early onset preeclampsia, if it is predicted, it will help in counseling the women and also it will help the clinicians in determining which patients need close monitoring and early referral to tertiary center. Then another important project which we are doing, which is very helpful, in fact, we are working with the district health system, is strengthening maternal and perinatal death surveillance and response action in tribal blocks of Palghar district in Maharashtra. So Palghar being a tribal district, we have maternal deaths and neonatal deaths, large number of maternal and neonatal deaths here. So we have this MPDSR system or the surveillance and response action being going on. However, we are strengthening this current. So whatever review meetings are being held in the district health system, we are attending them, and whatever actions are to be taken, because currently if you see the response component is weak. So whatever actions need to be taken on the modifiable factors, we are strengthening them. Also to improve the quality of reporting of maternal and perinatal deaths, especially stillbirths, if you see a lot of them go unclassified. So we have trained the service providers, the medical officers, the ANMs. We are improving the quality of reporting, corrective actions, what need to be taken on the identified modifiable factors to reduce these deaths. Another project which we have currently is by Dr. Krishna from our institute, Krishna Ita, is molecular analysis of HLA-G in pregnant tribal women and its role in infectious etiologies modulating intrauterine inflammation. This is a prospective cohort study, and this is a very important study because it will identify molecular variations in HLA gene and associated infection in a cohort of tribal women and its influence on pregnancy. Then Director Ma'am spoke about the IR projects, the implementation research projects. So we have this National Health Research Priority Project, NHRP project, which is an ongoing project, developing and implementing effective intervention delivery strategies of Anemia Mukt Bharat Program 2.0 to reduce prevalence of anemia amongst vulnerable populations in selected districts of India. So this is basically going on in 6 sites all over the country. Marachari Dohanu is one of them. And we have at our headquarters, Dr. Priyanka, who is coordinating this study. And we have a very good support. Again, it is a biggest example of the tripartite partnership, wherein along with me, I have Dr. Nitin Ambadekar as the co-PI, Dr. Geeta Pardesi as one of the co-PI, and our district and civil surgeon also as investigators. So here what we are looking at, whatever beneficiaries are there in the Anemia Mukt Bharat program, we want to reduce the prevalence of anemia in these selected 4 beneficiary groups, because as we all know, the prevalence of anemia is more prevalent in pregnant women, under 5s, adolescent girls, and reproductive age group women. More so the reproductive age group women we wanted to focus because there's no platform as such wherein the screening and prophylactic doses are given to the reproductive age group women. So these 4 groups will be actually targeted in this particular project, and outcome will be an optimized model will be developed for implementation of strategies in the Anemia Mukt Bharat program, which will be developed and which can be scaled up in other districts of country for reduction of anemia. So this has just been started. We had a dissemination meeting along with the district health officials in the month of April, and we are in the formative phase. Then implementation phase will be then continued. Then another project in maternal and child health, we have assessing the feasibility of point of care device in community-based screening of sickle cell disease and thalassemia in tribal district of Palghar, Maharashtra. We have a pediatrician, Dr. Suchitra Surve, who is leading this project. And basically, we are seeing the feasibility of point of care device in community-based screening for sickle cell disease and thalassemia. So when we just visited MRHRU, we showed Collector Ma'am also, and DHO sir also knows that this Gazelle instrument, it is a very portable, easy to carry device in the primary health centers, wherein we can screen along with this device, especially sickle cell disease and thalassemia. So after our during this project only, we are very happy to share that district has already procured for all the block 7 Gazelle machines, which they would be actually training the lab technicians and using this machine in the field. And in our project, what I would say more is that we will create more data when we are going to compare the results with this Gazelle machine and a HPLC. Because HPLC is the gold standard. We have data for the comparison of Gazelle and HPLC, but more data is on the women or the adults. So under 5 children, we are doing this project, wherein we are doing in the Amgaon PHC of Talasari block, wherein Dr. Suchitra is leading this project. 5,000 children we are going to screen, and we will be comparing the results of all these children with HPLC and Gazelle. So this will give very important data. Then improving infant and young child feeding practices, IYCF practices in tribal block of Palghar district. Again, we just released the IC material which came out from this project. This again, pediatrician Dr. Suchitra Surve is leading this project, and we are doing is in the Ganzad PLC. This is much needed because what we thought, as Collector Ma'am also said, this is the root cause basically for malnutrition, which is a prevalent problem in Palghar district. So if we teach the mothers how to do the recipes, it will actually help to reduce the malnutrition, because the diet which will be given by the mothers, they are very keen to learn. So we have already trained the Anganwadi workers and in turn the mothers to make these recipes. So we'll be doing a pre and post intervention survey where we'll be demonstrating that how these interventions can can improve the IYCF practices. Then in women's health, we have a project on assessing usage and disposal pattern of menstrual hygiene products among women in rural and urban India. So Dr. Dipti Tandon from our institute, she is doing this project which will be completed in this month itself. So this study will evaluate the usage and disposal patterns of menstrual hygiene products among women in rural and urban India. So both centers she is doing in Mumbai urban and also in rural Palghar district. Then we have a population-based health survey at Model Rural Health Research Units in India, MRHRU, Dahanu. So DG sir has already mentioned in his speech, and Gitanjali ma'am also mentioned, this study is very important because firstly, what we felt important is this will be an annual activity. So it will actually give us data every year, what is there in the community. It will provide comprehensive data regarding health of communities that records data for multiple health indicators at a frequency that can generate information for action through MRHRUs across India. What we would say is this is not focusing only on reproductive and child health, but we were in the working team, myself, Dr. Rahul Gajpe from Vadi, and some of the MRHRs were identified by headquarters. And we were in the working team wherein we developed a set of indicators, which includes not only RCH indicators, but also communicable diseases, non-communicable diseases, other many indicators are there. So this project will be very important to actually tell us about the health problems in the community. So this is being done across all the 35 or 36 MRHRUs across the country, led by DHR. Then another project we have is Integrated Palliative Elderly and Mental Health Care, IPM, for establishment of MRHRU. So this is again by DHR initiative wherein we are one of the centers. It's going to identify the gaps in healthcare delivery systems, design and evaluate primary care model, which can be scaled up. So this is again a community-based survey which we have just completed. We would be training the ASHAs, so they will then actually be geared up to look into this aspect. Then another important project, again National Health Research Priority Project by Dr. Shaina Begum from our institute, who is leading this project. Implementation research to enhance the screening, early diagnosis and initiation of treatment for oral, breast and cervical cancer in selected districts of India. So the expected outcome of this project is it will develop a model to improve the district level coverage and quality of screening, early detection and time to treatment initiation of oral, breast and cervical cancers, which are the most common cancers, within the context of NCD program, which is co-developed with the district implementation partners. So this is, we are very thankful to the district team that they are working closely in this implementation research project along with Dr. Shaina and her team. Then another one which we have is deciphering molecular diversity of dengue virus, which is circulating in tribal blocks of Palghar district in Maharashtra. So Dr. Kiran Munne and Dr. Shailendra are scientists. They are working on this project because dengue we know is a problem in Palghar district. So this study will determine the genetic variability among the circulating dengue virus serotypes and presence of co-infections in tribal population. So we have the diagnostic facilities. This was all about the research projects which we have completed, which were the ongoing projects. We have diagnostic facilities. We are the Sentinel Surveillance Center under the National Vector-Borne Disease Control Program since 2017. Then COVID-19, we have already, it was already shown in the video. Dr. Mahale was at that time director. We were the first and only MRHRU to establish this facility. And around 61,000 samples have been tested at this unit. Dengue we are testing since 2017, dengue and chikungunya. Then leptospirosis also we are doing since 2021 and influenza AB also. So these are all the diagnostic facilities which we are doing. Then another third important activity which we would like to focus is capacity building because we really want to help the district health system. So capacity building has already been done in the area of snakebite. When Dr. Rahul was there, I mentioned cervical cancer and NCDs. Dr. Shaina, Dr. Anushri, Dr. Kiran, they are already into this IR project also. They're going to train the health providers. Dengue, sickle cell disease, we have already trained. Birth defects, then RCTs also. Then NASH, we had trained. PCOS, Dr. Anushri had done a very large meeting with the district health officials wherein she trained all the medical officers and the ANMs for PCOS. Maternal and perinatal death surveillance and response we have trained. Then we had a basic workshop on qualitative analysis with focus on rapid analysis for implementation research, wherein especially analysis of qualitative data we trained the researchers. Then we also had a workshop for Grant Medical College and JJ Hospital researchers, especially for grant writing and proposal development. We were very happy that after that they actually came out with project proposals which were presented in the research advisory committee. And one more thing I would like to share that, glad to share that I have been identified as a research guide for PhD in community medicine under the Maharashtra University of Health Sciences, Nasik. And two of my students are working in Palghar district, wherein they have two projects. They're doing PhD in community medicine. So two projects are going on. One of them is on spacing contraception and another one is on anemia in and out of school adolescent girls, which is a problem again. So outcome, like we have publications around 30. We have 2 policy briefs and we have IC materials, which we have already seen. Some of them we have released. And Emaracheru Dahanu has been selected as one of the regional clinical trial units under the intent. This is a flagship initiative by ICMR. So these are all the acknowledgements. We would really like to thank all our partners, right from Department of Health Research, ICMR, our former directors, Dr. Kolkute sir, Dr. Mahale madam, we are glad that they are here today. Then Dean, Grant Medical College, Dr. Gitanjali Sachdeva, Director ma'am, who is always supportive and inspiring for us to work. Then we have Dean JJ, Director Health Services, Government of Maharashtra, all the members of LRSC, Dr. Sanjay Chavan, we have learned a lot from him, nodal officer, former nodal officer of MRHRU Dahanu, all the state, district and officials, MRHRU staff, funding agencies, all the scientists and investigators at our institute, ICMR, NIRCH. It's a very good platform for them to do research and all our other departments, admin stores and all other departments. So this was all about the brief about MRHRU. Coming to the National Symposium on Rural and Tribal Health Research, Issues, Challenges and Solutions, which we will be having tomorrow and day after tomorrow after today's inauguration program. So basically what we thought is, as Gitanjali ma'am told, we didn't want to have just the plaque installation and the decennial celebration. Along with that, the scientific deliberations will be very good for tomorrow and day after tomorrow. So objectives are to provide a platform for researchers and MRHRU nodal officers and participants from other MRHRUs across India to share their experiences, good practices and lessons learned. And we are very happy the response which we got from other MRHRUs. Then to identify the priority health issues for tribal and rural populations and to highlight the challenges in implementation of research projects in rural and tribal health settings and identify strategies to address these challenges. So just to give a glimpse, not going into details, tomorrow day 1, we have the areas which we'll be covering is plenary session on tribal health research. And we are glad to share that we have the role model, Dr. Digant Amte and Dr. Anagha Amte, who will be delivering the plenary address tomorrow. They are the real heroes in the field who are working at ground level. Then we have other sessions like maternal and child health nutrition from research to policy session, MRHRU network and their endeavors, where we have actually invited other MRHRUs to present their work. And we have poster session tomorrow evening, which also gave opportunity to many participants to present their work. Then day 2 will be half day on 11th September. Very important panel discussion in the morning, which we have is hemoglobinopathies, a roadmap ahead. So we have Dr. Deepti Jain, we have Dr. Harpreet Kaur and many others working in the area of sickle cell anemia, whom we have invited for this panel discussion. Then we have one session on communicable and non-communicable diseases in tribal areas, and then the valedictory session wherein we'll be completing this. So this is all about the brief of MRHRU and symposium. Thank you.
Thank you, ma'am, for taking us through the enriching journey and briefing us about the objectives of the symposium. Next, we move on to our address by our chief guest, Dr. V.M. Katos, sir. So we are fortunate today to have Dr. V.M. Katos. Please, sir, ask the chief guest. So we are fortunate to have you, sir, today. So I request Dr. Beena Joshi, ma'am, to kindly introduce, sir.
Dr. Kandoj is no new person to us. He's the guide and support to the entire ICMR family. Thank you, sir, for being here. There are a lot of project staff, and I think they all will be benefited by knowing sir's presence here. So, Dr. V.M. Kandoj has been the former DG ICMR and Secretary DHR. He is a medical graduate with specialization in medical microbiology and has been the visionary scientist and decorated scientist, visionary leader who changed the landscape of public health research in the country. I remember his words, आपके research से last person को क्या मिलेगा? The last person who is the beneficiary. So he always brought in that vision that how your research would impact the general common man. And we were very fortunate to have your guidance and mentorship. He is currently the editor of Indian Journal of Leprosy and president of the Tuberculosis Association of India, continuing his lifelong dedication to public health and infectious disease research. He is also the distinguished fellow of all science academies in India, all 4 science academies in India. He, along with his very able partner, Dr. Kiran Katoch, has championed research in tribal health with involvement of health systems and has been guiding force in research activities and mentoring the next generation of scientists. Thank you, sir. Over to you.
एक्चुअली ये बड़ा, मैं कहूँगा, भावुक क्षण है ये सब। ग्रीट तो मुझे सिर्फ स्टेट हेल्थ के कोलिग्स को ही करना है, बाकी तो सब मेरे अपने सिस्टम के लोग हैं। मैं जैसे सारी आने के बाद कैसी, मैं क्यों भावुक क्यों महसूस करते हैं हम लोग, क्योंकि एक तो इतने पुराने मित्रों को, साथियों को मिले हम आज। दूसरे, यू नो, एज यू मूव इन द लाइफ, व्हाट यू वांट टू सी, आपको जो भी न्यूज़ खराब है, डिस्टर्ब है, आप उनसे दूर भागना चाहते हो। आईसीएमआर सिस्टम में हमारे इस अक्टूबर में 50 साल हो जाएंगे। वी ज्वाइंड आईसीएमआर इन अक्टूबर 75। So we have seen the evolution of the uncertainty, you know, आईसीएमआर कितने 114 साल पुरानी है, तो उसमें 50 साल हम भी इसका पार्ट रहे हैं। You know, in this journey, but you look at your journey, you look at the journey of the organization, look at the journey of today's India and different parts of the country actually. वो सब मैटर करता है। ये जब सारे ड्रीम्स बिल्ड हो रहे थे, कुछ कोइंसिडेंटल थे, कुछ आपने देखे सामने, कुछ आपको लोगों ने महसूस कराया कि ये महत्वपूर्ण है। तो आई थिंक यू मूव ऑन दैट। अब जैसे कल 2 दिन हम सिम्पोजियम में डेलिब्रेट करेंगे सीरियस इशू, हमें क्या करना है, हमारे साथ और जो लोग और दूसरी यूनिट से आ रहे हैं वो भी देखेंगे कि क्या करना है, हमें सोचेंगे, वो अपने आइडियाज देंगे, वो क्या कर रहे हैं। So this meeting has a purpose, serious purpose actually, कि इससे आगे क्या। लेकिन यहाँ तक आने का एक जर्नी है एक्चुअली। वो जर्नी कोई मेरी व्यक्तिगत जर्नी नहीं है, वो जर्नी सिस्टम की है, ऑर्गेनाइजेशन की है। मैं तो उसका एक पार्ट था। हमने जैसे कहा कि हम दोनों तो सिलेक्ट हुए, तभी हम लाइफ पार्टनर भी बने, तो हमारे लिए तो एक जरिया था ऑर्गेनाइजेशन का भी और लाइफ का भी। लेकिन आगे देखते हैं आप कि ये जो ड्रीम बिल्ड हुआ रूरल हेल्थ वाला, सेकेंड कोइंसिडेंटल था ये। घाटमपुर में जब इन्होंने फील्ड प्रोजेक्ट शुरू किए, मैं इसका विरोधी था, मैं कभी उसका समर्थक नहीं था। हर हेल्थ वाज इन चैम्बर्स, और इनका जो जो जुझारूपन था, हॉस्पिटल के भी पेशेंट देखने, वहाँ 300 किलोमीटर जाके वो भी देखने, और साथ में प्रोजेक्ट लिखने और पैसा बाहर से लाना, क्योंकि ऑर्गेनाइजेशन आईसीएमआर का नॉट ए सिंगल पेनी केम इन दैट एक्चुअली, नॉट ए सिंगल पेनी। So running it for 10 years actually on extramural projects, you know, that is the evolution as the time moves there actually. Coincidentally लेप्रोसी के लिए जाते हैं, लेप्रोसी के एक वैक्सीन की एवेल्युएशन के लिए जाते हैं, but then she gets involved into the whole game. पर उसमें जो लर्निंग एक्सपीरियंस है, जो मैं आपको आज कहूंगा कि आपके लिए कैसे आज मैटर करता है कि जहां पे आज हैं आप, लर्निंग एक्सपीरियंस थे कि जो पब्लिक हेल्थ रिसर्च है वो स्टेट की पार्टनरशिप के बगैर नहीं हो सकती। और यूपी की गवर्नमेंट ने उनका समर्थन इन्होंने लिया बातचीत करके सबके साथ। मेडिकल कॉलेज जो कानपुर का था, इवन आगरा का था, एम्स के लोग जो उसके हमारे मेंबर थे, वो सारे इन्वॉल्व हुए साइंस के अंदर। Then this whole idea came of a unit actually, which is again nurtured by a dreamer, Professor Ganguly. वो हर साल इसकी कमेटी की मीटिंग में गए, कभी नहीं मीटिंग है तब भी गए। तो उन्होंने वो को हम एक अल्ट्रा मॉडर्न बायोलॉजिस्ट के रूप में देखते हैं नॉर्मली, बट द मैन हैड अ वेरी डीप कनेक्शन विद द पीपल एक्चुअली। तो उन्होंने इनको मोटिवेट किया, प्रोजेक्ट्स लिखे, आगे किए, कमेटियां बहुत हाई पावर की बनाई जिनके बड़े एनालिटिकल माइंड थे। तो तीनों इंग्रेडिएंट बिल्ड हुए एक्चुअली, जो आपके पास है। आपकी जो 10 साल की कामयाबी है, आपने सब कुछ वही किया एक्चुअली। लेकिन वहां पे तो इवॉल्व हो रहा था, ये सोचा नहीं था किसी ने कि एक यूनिट बनेगी। ये नहीं सोचा था कि ये कैसे एक मॉडल बनेगी। So that was, how you started interacting with the people. She started interacting, then the Professor Ganguly started interacting with those people interacting. मैं तो था भी नहीं, कहीं आस पास नहीं था उसके, कहीं नजदीक नहीं था कहीं भी। तो मेरे बिल्कुल जहन में भी नहीं था ये। तो मेरी ट्रांसफॉर्मेशन हुई है दिल्ली मूव करने के बाद। मैं एक बिल्कुल हार्ड कोर बायोलॉजिस्ट था, एक हार्ड कोर जीनोमिक पर्सन था। इसके क्लिनिकल गोल्स थे क्लियर कट, जो भी मैं डीएनए फिंगरप्रिंटिंग मेथड निकालूं लोगों तक जाए, वो जो भी डीएनए चिप बनाऊं उसकी एप्लीकेशन होनी चाहिए। ये मैं था बिल्कुल, मैं साइंस को एब्स्ट्रैक्ट में नहीं देखता कभी भी। लेकिन पब्लिक हेल्थ नीड्स के हिसाब से जो मैं मूव किया, वो तो मैं दिल्ली जाके मूव हुआ। तो लेकिन सवाल है कि वो कोइंसिडेंटल है, कोइंसिडेंटल इवोल्यूशन ऑफ इंडिविजुअल्स, इंस्टीट्यूशन एंड ए सिस्टम, देन यू सी ए मॉडल इमर्जिंग। अब वो मॉडल हम 15 राज्यों में ला पाए मेरे अपने पीरियड में, ये पहला था। लेकिन उसके लिए कैटलिस्ट कौन थे? कोलकाता साहब। हर जगह लोकल आदमी, लिंक पर्सन चाहिए था आपको, जो लोगों की जो जुझारू हो, जो उस विजन को देखे एक्चुअली। तो इन्होंने सिस्टम को कन्विंस किया। सिस्टम को कन्विंशन करने के बाद ये चीज यहाँ पे आई, सिस्टम कन्विंस हो गया तो सिस्टम का सपोर्ट मिला। अब उस सपोर्ट में आज पवार साहब भी थे, जो उस टाइम के डायरेक्टर भी थे हेल्थ सर्विसेज के, उनका क्रिटिकल रोल। जो 13 की मेरी विजिट यहाँ की, फिर मैं 14 भूल गया था, मैडम ने मुझे याद कराया कि 15 के शुरुआत में आया था मैं लास्ट। तो वो स्टेट सिस्टम का इमीडिएट सपोर्ट आना, स्टेट सिस्टम के आगे बन के उसको आगे के लेवल तक ले जाना, दैट कोर एलिमेंट वाज देयर एक्चुअली। इट डिडंट हैपन एवरीवेयर, इट डिडंट हैपन। मैं मेरे राज्य में, हिमाचल जो मेरा पूर्ण राज्य है, वहां के राजा में था, जो चीफ मिनिस्टर थे उनमें, उन्होंने अपने आप ही जैसे उनकी अप्रूवल की, उन्होंने जगह भी डिसाइड करके कहाँ करी और कहाँ उन्होंने उद्घाटन करना, वो डेट भी उन्होंने अनाउंस कर दी। मेरे को तो जस्ट इनवाइट फोन आया कि मुझे आना है। So that was a unit actually owned by the chief minister from the day one actually. Is no more. उसके बाद ओनरशिप कमजोर पड़ गई। अब जो दूसरे चलाने वाले थे वो भी कमजोर पड़ गए। तो सवाल क्या पैदा होता है कि यहाँ की जो आज की कामयाबी हम देख रहे हैं, वो एक कंटिन्यूटी। ये संजय चौहान जी आए, मैडम आई, अब राहुल भाई आए, उसके बाद अब की टीम देखिए, मैडम आई, फिर मैडम की टीम देखिए, वाइब्रेंट टीम। तो इस टीम ने इस पीरियड में ये करके दिखा दिया। इतने सारे प्रोजेक्ट, इतनी सारी जो एक्टिविटीज ली इन्होंने, वो एक्टिविटीज सारे के सारे यहाँ के लोगों की जरूरत के अनुसार थी। See, they were the problems concerning the people of this place actually. जो स्नेक बाइट का इशू था तो वो उन्होंने पिकअप किया। इन्होंने हीमोग्लोबिनोपैथीज और दूसरे इशूज किए। मदर और चाइल्ड हेल्थ के इतने सारे इश्यूज पिकअप किए जो उनके हेल्थ को प्रभावित करते हैं, जो यहाँ के लोगों के हेल्थ को प्रभावित करते हैं। उनके लिए टूल लेके आए, उनके लिए चीजें सिस्टम लेके आए, उनके लिए इंफॉर्मेशन लेके आए। तो इतने सारी जो अध्ययन, जो स्टडीज की हैं, उनसे जो निकला है आउटपुट वो सामने दिखता है। तो 10 साल में ये एब्स्ट्रैक्ट साइंस नहीं है, ये प्योरली प्रैक्टिकल साइंस है। ये वो प्रैक्टिकल साइंस है जो लोगों तक पहुंची। और आज उसके जो पार्टनर्स हैं, कम से कम 2 पार्टनर, मैं बहुत खुशी होती है आज जे वाले भी उसी स्पीड के साथ जुड़े होते। करिए भगवान उनको भी सद्बुद्धि दे। लेकिन राज्य सरकार तो जुड़ा, राज्य सरकार तो जुड़ी। अच्छा, हमारे मेडिकल कॉलेज सिस्टम में अपनी उनकी अलग दुनिया है, वो अपने अलग दुनिया में रहते हैं। कभी वो भी जमीन से जुड़ेंगे, मैं आशा करता हूँ इस बात की भी। लेकिन बहुत सी जगह जुड़े भी हैं, ऐसा नहीं हर जगह नहीं जुड़े हैं। भले लोग हैं वो, लेकिन वो उनकी प्रायोरिटीज डिफरेंट है। लेकिन 2 पार्टनर्स, की पार्टनर्स जो जुड़े हैं, इन्होंने कामयाबी करके दिखाई। कल 2 दिन और 3 दिन में देखेंगे तो आप दिखाएंगे जैसे हमारे तिरुनेलवेली में क्या जो सक्सेस स्टोरी के 2 इंग्रेडिएंट थे। लोकल मेडिकल कॉलेज वाज टॉप देयर एक्चुअली, एंड देन इक्वली इंपॉर्टेंट वाज द एनआईई। राज्य सरकार भी पॉजिटिव थी, तो तीनों इंग्रेडिएंट मिल गए वहां पे। लेकिन 2 ड्राइवर थे मेन, तो दोनों ड्राइवर्स ने करके दिखा दिया कि क्या चाहिए। वहाँ मेडिकल कॉलेज वाले जब यूनिट स्टार्ट होने से पहले साइंस के प्रोजेक्ट लेके आ जाते थे, क्या चाहिए उनको, कौन सी प्रायोरिटी है, डर्मेटोलॉजी में क्या प्रायोरिटी है, नेफ्रोलॉजी में क्या प्रायोरिटी है, वो लेके आते थे अपने आप। आई थिंक दैट इज, ये जो कॉम्बिनेशन है सारे फैक्टर्स का, ये अब हर जगह नहीं मिलता। और जगह से कामयाब स्टोरीज हैं, और जगह से भी, बट दे आर सिलेक्टेड फोकस जो सक्सेस स्टोरीज हैं। ये 2 एग्जांपल जो मैं आज दे रहा हूँ, ये 2 एग्जांपल्स आर ए सक्सेस ऑफ टोटल नेचर एक्चुअली। तो हनु का जो 10 साल की जो यात्रा के बाद हम देखते हैं, तो एक शांति महसूस होती है। हमें इस चीज में शांति चाहिए। हमें ये चाहिए कि यार ये जो देश में इन्वेस्टमेंट हुई, ये ठीक हुई। क्योंकि मैं जब इन स्कीमों को लेकर compete कर रहा, नया सिस्टम था, नया डिपार्टमेंट था, उसमें बहुत सारे क्रिटिक थे और वो सब सही थे एक्चुअली, नन ऑफ द क्रिटिक्स वर रॉन्ग एक्चुअली। उनका लगता था कि आपको देखिए यार इसको चलाएगा कौन, पैसा इन्वेस्ट कर रहे हैं तो क्या हो रहा है। हमारे साथ उस समय एक सरदार जी थे, एक्सपेंडिचर सेक्रेटरी गुजरात साहब, मुझे पंजाबी में बोलते थे, वो तुसी डॉक्टरों दे 5500 करोड़ लुटा रहे हो, इन्होंने कुछ नहीं करना, ठीक है। एंड ही वाज करेक्ट एक्चुअली, यू नो दोस गाइस एक्चुअली, कि उनको पता है प्रैक्टिस में खोए हुए कुछ नहीं करेंगे ये। लेकिन हमने कहा कि सर कुछ लोग तो अच्छे हैं कंट्री में, वो करेंगे, मौका तो दो। Ultimately, that entire system of the parliamentarians, those people in the comment, none of them was wrong actually. None of their comments were wrong. But the point is कि we have to attempt it actually. We have to succeed actually. So Bhanu becomes an example of a great first leadership. देखो 3 डायरेक्टर्स, तीनों ने लीडरशिप में देखा, इसकी अपॉर्चुनिटी देखी। राज्य सरकार, उन्होंने इसकी अपॉर्चुनिटी देखी, हमें क्या चाहिए। तो इतनी सारी चीज, स्टेट ऑफ द आर्ट लैब जिसकी सर्विसेज लोगों को मिली और कल और मिलेगी। इतने सारे हमारे जो नोडल ऑफिसर, इन्होंने अलग दुनिया बिल्ड करी। अच्छा, साइंटिस्टों ने अलग चीज बिल्ड करी। तो ये इतनी सारी ये ह्यूज लिस्ट है 20 15 20 की, एक दिन ऐसे थोड़ी होगी कोई ये। इट इज अ कंट्रीब्यूशन बाय इन्यूमरेबल पीपल, बाय द प्रोजेक्ट पीपल, बाय द नॉन प्रोजेक्ट पीपल, बाय फैकल्टी, एवरीबॉडी। और अभी के जैसे आज के इकोसिस्टम देखिए, कल क्या, आज का इकोसिस्टम बड़ा साफ बोल रहा है, हर साहब इसको एक लेवल ऊपर जाना चाहते हैं। उनके बारे में मुझे बहुत अच्छा से क्या लगता है बार बार कि ही इज डायरेक्टली कनेक्टेड विद द पीपल एक्चुअली। वो आपकी यूनिट्स के साथ डायरेक्टली उनका कनेक्शन है, उनका डायरेक्ट कनेक्शन जिन जिन से वो डील करना चाहिए, वो डायरेक्ट कनेक्शन है उनका। मेडिकल कॉलेजेस के साथ डायरेक्ट कनेक्शन रखते हैं हम। तो इन्होंने ये जो रखा है कि अगर आप हर साल सर्वे करेंगे यहाँ पे, तो सीधा से नीति आयोग तो कुछ मिलेगा ही, क्योंकि हमें क्या पॉलिसी बनानी है इतने स्टेटों में रूरल हेल्थ के लिए। लेकिन आपको आइडिया मिलेगा कि यहाँ के लोगों को चाहिए क्या, कौन सी टेक्नोलॉजी चाहिए। क्योंकि ये यूनिट जो मैं आपको याद कराना चाहता हूँ इसलिए बनी थी, टू टेक द टेक्नोलॉजी टू द पीपल। एक लाइन है उसके यूनिट के अंदर जो प्लानिंग कमीशन से अप्रूव हुई और यूनियन कैबिनेट से अप्रूव हुई 2013 में, उसमें सिंगल लाइन है ये, टू टेक द टेक्नोलॉजी टू द पीपल। नाउ उसके लिए यू नीड द नॉलेज अबाउट द पीपल। यस, वेरी मच, दैट विल बी हेल्पफुल, दैट्स द नंबर वन डेफिनेटली। तो जो प्रेजेंट लीडर ने सोचा है वो करेक्ट सोचा है, वो आपके लिए बिल्कुल, यू शुड डू द बेस्ट एक्चुअली इन दैट। तो उसमें से आपको लेसन मिलेंगे कि हाँ, अगर ये समस्या है जो सॉल्व ही नहीं हो रही, जो ट्रेंड में करने के नॉर्मल इवोल्यूशन ऑफ सोसाइटी में जिसके ऊपर कोई अंकुश नहीं लग रहा, तो अभी तक जो प्रॉब्लम नहीं है वो आपने आइडेंटिफाई की है, आपको महसूस लगी है, आपको लगा आपकी जजमेंट करेक्ट है बाई एंड लार्ज। लेकिन कुछ प्रॉब्लम ऐसी निकल के आएंगी उस सर्विस के अंदर जो आपने नहीं सोची है, वो किसी ने भी नहीं सोची है। उसमें तो मैं कई बार बोलता हूँ, कौन बताता है आपको, पहली बार ब्यूरोक्रेट बताता है। हम जब ऊना में गए तो ऊना का जो आईएएस ऑफिसर, जो डिस्ट्रिक्ट कलेक्टर था, उसकी इंफॉर्मेशन स्टेट के डायरेक्टर से कई गुना बेटर थी, बिकॉज द कलेक्टर वाज लिंक्ड विद द पीपल, ही वाज लुकिंग एट व्हाट द प्रॉब्लम्स देयर एक्चुअली। तो उन्होंने जो लिस्ट बना के दी वो हमारे हेल्थ वालों ने नहीं दी। हेल्थ वालों के तो प्योरली क्लिनिकल सेंट्रिक थे, पब्लिक हेल्थ वाली चीज तो उनके दिमाग में नहीं थी बिल्कुल। किसने बताई? आईएएस ऑफिसर ने बताई। तो ये जो ब्लेंड है, ये हमारे टेक्नोक्रेसी के दिमाग हैं सारे, इनको समस्या पता है, ये इनके अंदर एम्पैथी है लोगों की प्रॉब्लम सॉल्व करने की। लेकिन सॉल्व करने का माध्यम कौन है? सिविल सर्विस। सॉल्व, उसको सॉल्व करके उसको सेट करने वाला कौन है? आपका नेताजी। तो तीनों का वो जो पाथवे है ऑफ लॉबिंग टू डीलिंग विद देम, दैट some सिस्टम ऑफ शुड सस्टेन एक्चुअली। और लेकिन उसी में आप देखिए कि आपको जब ये प्रॉब्लम पता लगी, आपको पता लगी इतनी टेक्नोलॉजीज भी अवेलेबल हो गई, तो जो गैप है अर्बन एरिया में, रूरल एरिया में, लोग मारे मारे काय को शहर में पड़े रहते हैं, मेनली टेक्नोलॉजिकली पड़े रहते हैं, तो यहाँ टेस्ट नहीं हो पाएगा। डॉक्टर हमारे फील्ड में भी शहर से भी कई गुना कॉम्पिटेंट है, उनका क्लिनिकल सेंस कई गुना बेटर है, लेकिन उनके पास उनका डायग्नोस्टिक नहीं होता। तो अगर वो डायग्नोस्टिक्स आप शुरू में पॉइंट ऑफ केयर या दूसरे डायग्नोस्टिक जो यहाँ के स्वास्थ्य के हिसाब से इंपॉर्टेंट हो गए, आप उनको टेस्ट करके देखेंगे, इंट्रोड्यूस करके देखेंगे, तो हर साल आपके एलआरसी में पहले की एजेंडा आइटम में यही चाहिए, इस साल में हम ये नए पॉइंट ऑफ केयर इवेल्युएट कराएंगे, ताकि या इवेल्युएट करेंगे हम, ताकि वो कम से कम वो अगर पता लगता है कि वो दहाड़ों में हो सकता है तो और पीएससी में भी हो सकता है। अगर वो ट्राइबल स्पेसिफिक इशू है तो ट्राइबल के और एरिया में भी हो सकता है टेस्ट। तो आई थिंक वो जो एरियाज वो आपको चूज करने हैं। तो आपके लिए एजेंडा है भी, आगे का काम कोई यात्रा बहुत एक्साइटिंग है एक्चुअली, बहुत कुछ है करने को। तो आई थिंक सर्विंग बोथ द पर्पस ऑफ द सेंटर, सर्विंग द पर्पस ऑफ द स्टेट, एंड देन यू नो द साइंस लेड बाय द स्टेट, वे द स्टेट ओन्स इट कि हमको ये चाहिए। जब आप ये करेंगे तो ये ओन करेंगे, तो कल वो जो मॉडल है वो राज्य सरकार हो सकता है केंद्र से पहले ही लागू कर दे। मैंने अपनी लाइफ में ये देखी है बहुत सारी चीजें, बहुत सारी टेक्नोलॉजी जब हमने एवेल्यूट करके दी, जैसे ट्रू नेट था टीवी का, तो जैसे वो हमने हंड्रेड्स जगह टेस्ट करके दिखा दिया कि रूरल एरिया में माइक्रोस्कोपी सेंटर एफिशिएंटली रियल टाइम पीसीआर करते हैं, विद 48 आवर्स ऑफ ट्रेनिंग दे कुड डू 97% करेक्ट। ठीक है, तब उन्हीं के मुख्यमंत्रियों ने अपने आप ही ले लिया। हमारे यूनियन गवर्नमेंट से अभी तक वो लागू भी नहीं किया था, कोई सेंटर से लागू हो, स्टेट से लागू हो गया कई जगह से। तो हो सकता महाराष्ट्र की सरकार, इनको जब लगेगा कि हाँ ये मॉडल यहाँ वर्केबल है, ये केंद्र से भी पहले कर दे। सो आई थिंक व्हेन यू लुक एट टुमारो, आपका बहुत दोनों पार्टनर महत्वपूर्ण है। आपके जो फंडर करने वाले वो इम्पोर्टेंट है, जिन्होंने क्रिएट किया आपको वो इम्पोर्टेंट है, उनको अपनी जरूरतें हैं वो इम्पोर्टेंट है, लेकिन राज्य सरकारों के पास इमीडिएट नीड है। अब जैसे सिकल सेल की बात कर रहे हैं, आपके बात हुई, मैंने बड़े ध्यान से सुन रहा था, वो 40 कितने बच्चे हम पैदा हो चुके हैं जिनको क्या मॉनिटर करेंगे, तो आप क्या मॉनिटर करेंगे इसमें? बड़ा सिंपल है कि उनमें कॉम्प्लिकेशन आएंगी। कितनों में कॉम्प्लिकेशन आई? अच्छा, वो कॉम्प्लिकेशन प्रिवेंट हो सकती थी अगर आपने सिर्फ माँ को इतना ही दिखाया कि वो गर्मी से बचाना, बच्चे को पानी का सफिशिएंट डिहाइड्रेशन नहीं होने, उसको डिहाइड्रेशन नहीं होने देनी है, तो उसकी आधी कॉम्प्लिकेशन तो डिले हो गई। अच्छा, तो स्कूल में जाएगा तो बच्चे के अंदर क्या प्रिकॉशन रखनी है, उसको उसी से प्रिकॉशन उसके दूर हो गई, उसको कौन सी वैक्सीन चाहिए वो से प्रॉब्लम दूर हो गई। अच्छा, तो यू नो यू हैव टू फाइंड व्हाट यू वांट टू इंटरवीन एक्चुअली। अगर आपने बता रखा है तो कल उसको सर्जरी की जरूरत पड़ती है, उसको एनेस्थीसिया के किस किस एनेस्थेटिक से कॉम्प्लिकेशन होती है, तो उसके बाद प्रॉब्लम अपने में सॉल्व हो गई। तो वो चीजें आप टेस्ट करके देखेंगे, प्रूव करेंगे कि हाँ ये जो थ्योरेटिकल चीजें हैं वो आपके पब्लिक हेल्थ सिस्टम को कितना कामयाब होती हैं। तो जो कुछ आप अभी कर रहे हैं, क्या वो इन जेनेटिक डिसऑर्डर पे कर रहे हैं, कुछ ऐसे रेयर जेनेटिक डिसऑर्डर निकल के आएंगे जो आपको अभी पता नहीं है। प्राइमरी इम्यूनोडेफिशिएंसी डिजीजेस अधिकांश 2011 तक नोन नहीं थी, 6 तो 100 से ज्यादा पता है इस कंट्री में है। उनके लिए आज सेंटर अवेलेबल है। हमारा आईसीएमआर का सेंटर वन ऑफ द बेस्ट, सेकंड बेस्ट सेंटर कंट्री का। तो आई थिंक जो आप मूव करेंगे साइंस करते करते तो आपको निकलेंगे वो प्रॉब्लम भी देखेंगे आपको। आपके पास टूल्स हैं, आपकी लेबोरेटरी है, उसमें आप टेस्ट करके आपको पता लग जाएगा कि ये समस्या यहाँ पे है, उसको सॉल्व करने का तरीका आपको आता है। तो यू नो आपके लिए बहुत ज्यादा आगे का एजेंडा तैयार है, आपके सोचने के ऊपर है क्या देखते हैं एंड हाउ डिफरेंटली यू लुक एट। उन किन चीजों को देखते हैं जो दूसरे को नहीं दिख रही, वो आपको दिखेंगी सबसे पहले, क्योंकि आप सर्वे कर रहे होंगे रिपीटेडली। आपके पास कोहॉर्ट्स हैं जिनको आप फॉलो कर रहे हैं, आपके पास ग्रुप्स हैं जिनको आप मॉनिटर करके देख रहे हैं इसमें ये करने से क्या हो सकता है, वो नॉलेज अवेलेबल है, लेकिन आपने नहीं ट्राई किया क्योंकि अभी तक वहां उस स्टेज तक पहुंचे ही नहीं, लेकिन आज पहुंच गए हैं आप। तो आई थिंक लुकिंग एट टुमारो, यू नो whether it is a very simple diseases or they are maybe the rare diseases or maybe they are primary immunodeficiency diseases, there are many of them are preventable, many of them जिनकी डिले हो सकता है आगे तक, एपिजेनोमिक मॉडिफिकेशन से बहुत ज्यादा फर्क पड़ सकता है उसमें। तो बहुत हाई एंड साइंस करने का मौका भी आपके हाथ में है, पब्लिक हेल्थ इंटरवेंशन का मौका भी आपके हाथ में है। कौन सी टेक्नोलॉजी जो स्टेट के साथ मिलकर आप निर्धारित करें कि ये टेक्नोलॉजी इंटर करनी है, आपके डिस्ट्रिक्ट की अथॉरिटीज, स्टेट की अथॉरिटीज के साथ आपने पहले ही निर्धारित करके कि भाई ये समस्या इतनी बड़ी है, इसकी कॉस्ट इफेक्टिवनेस में इतना फायदा होगा, ये सब आपको शुरू से ही लेके चलना है। अगर आप वो लेकर चले तो नेचुरली आपको डे वन से आपका आपका ग्राहक तो तैयार है, कौन उसको लेगा, वो तैयार है पहले से, आपकी साइंस उसके अराउंड हो तो आपका तैयार है पहले से। तो आई थिंक आगे वेरी लुक एट द हॉराइजन्स, बहुत बड़ी चीजें दिखती हैं। हमारी भी व्यक्तिगत खुशी है आज इतने सारे पुराने कुलीग्स मित्रों से मिलिए, और उस जगह जिसके साथ हम जुड़े थे कभी, वो एक फलता फूलता एक पेड़ है एक्चुअली। दैट इज अ ग्रेट हैप्पीनेस टू अस, you know, and but there's a great opportunity for you people to, I think, do so many things which you are capable of, which you have the motivation to do, I tell you. I think that gives a lot of energy at this age to us. मतलब आते दिन के बाद सोचने का यही मजा आता है कि हम इस ऑर्गेनाइजेशन का पार्ट थे और इस कंट्री का भी पार्ट है। इस सोसाइटी का भी पार्ट है, जहाँ पे आप जैसे लोग हैं जो इसको अच्छी तरह से चला रहे हैं और चलाएंगे। शुभकामनाएं, जय हिंद।
Thank you, sir, for your motivating words and sharing your valuable thoughts. It's always a new learning whenever we listen to you. Thank you so much. May I now request our director, ma'am, Dr. Gitanjali Sachdevas, ma'am, to felicitate Katut, sir. May I please request Dr. Kiran Katoch, ma'am, former director ICMR Jalma, to please come on the dais. Ma'am is this is MRHRU is actually brainchild of ma'am. She has established first MRHRU model at ICMR Ghatampur, which has been trained across the country. So I request Anushri ma'am to please come on the dais to felicitate ma'am. Thank you, ma'am. संत तुकाराम महाराज म्हणतात, धन्य ते सुकृताचे बीज जे लावले जनसेवेत. अर्थात blessed is the seed of good deeds when sown in the service of good people. The seed sown 10 years ago has now grown into a flourishing tree, and we are all here gathered to celebrate its decennial milestone. Now we want to take a moment to specially acknowledge the stalwarts among us whose vision, leadership, and tireless contributions have helped MRHRU Dahanu to reach this milestone. So I request gathering for a big round of applause for all these contributors. To begin with, I would like to request Dr. Sanjeeva Kolkute sir to please come on the dais. I request Director ma'am to please felicitate sir. It was during sir's tenure the seed of MRHRU was sown and the MRHRU for its MOU for its establishment was signed. Yes, sir. Yeah. Mic and mic is mic. And mic.
आमच्या महाराष्ट्राचं संस्कृती आणि ज्ञानेश्वरांचं पसायदानंतर त्याच्यामध्ये एक हा काव्य म्हणजे आहे सगळ्यांना शांती राहू सगळ्यांना आम्ही तर ज्ञानेश्वरांचं जसं तुकारामांनी सांगितलं तर या MRHRUच्या अनुषंगाने ही गोष्ट झाली की एवढं लोक लावलं आली MRHRUचं एवढं लोक लावलं आली त्याचा वेळ गेला घटना होती.
Thank you, sir. Thank you, sir. May I now request Dr. Smita Mahale, ma'am, and I request our director, Dr. Gitanjali, ma'am, to felicitate ma'am. As director ma'am mentioned, it was under ma'am's able leadership, the construction of building was completed. She took special effort during pandemic to establish COVID testing, as we heard from director ma'am. Thank you, ma'am. Next, I will request Dr. Sanjay Mahendra sir to please come on dais. I request Dr. Geeta Pardeshi ma'am to please felicitate sir. Sir was former additional DG and he is also, as we heard, part of our research advisory committee. He has provided intellectual inputs and guidance for all our research activities. Thank you. Thank you, sir. Next, it's my pleasure to call Dr. Sanjay Chauhan sir. I request Dr. Ragini ma'am to please felicitate sir. Sir is former scientist and nodal officer for MRHRU Dahanu, as we heard. And it was under his supervision and guidance the construction of MRHRU took shape. He also initiated pioneering projects like body effect surveillance and sickle cell disease human screening. Thank you, sir. Next, I am happy to invite Dr. Rahul Gajbhie, sir. I request Dr. Shavani Mukherjee, ma'am, to please come on the dais to felicitate sir. Dr. Rahul Gajbhie, sir, is scientist and currently nodal officer for MRHRU Bani. He was member secretary when he shouldered the responsibility of construction and took initiative in several key initiatives of MRHRU. He developed snake bite management model for Dahanu, which has been now scaled up across national levels. Thank you, sir. I would also like to make a special mention of Dr. Satish Pawar sir and Dr. Archana Patil ma'am, who had come for flag installation, but they could not come here. So they also played a very pivotal role in state as a state health officials in initial phase, which and extended crucial support in terms of intellectual inputs and their guidance. I would also like to specially acknowledge some district health officials, Dr. Yes. Yes. Dr. Santosh Chaudhary sir, our DHO. I would request Dr. Vikas Dighe sir to please kindly come on dais to felicitate sir. Please sir for your continued support. A special mention of our former civil surgeon, Dr. Sanjay Bodade sir, who was here a while ago. So, sir generously provided temporary space for in SDH Dahanu during the formative phase, and he also extended his continued support when he took charge as civil surgeon in Palghar district. Also, I would like to extend my thanks to Dr. Dayanand Suryavanshi sir. Sir had also come for the plaque installation. So, he also played pivotal role in facilitating and supporting various research activities in Palghar district. Along with this, I would also like to specially acknowledge some contributors who have also immensely contributed, but unfortunately, they could not come today to grace the occasion. Special mention of former civil surgeon Dr. Kanchan Madare ma'am, late Dr. Anil Thorat sir, former medical superintendent Dr. Arun Yadav, former DHOs Dr. Santosh Gaikwad, Dr. Lalit Sanghi from Grand Medical College and Sir JJ Group of Hospitals, along with other contributors, project staff, institutional staff, Dr. Krishna Ita, who was very instrumental during the COVID times, Mr. Jagdish, Mr. Kohli, and Mr. Lobo, our staff, who have been very instrumental in making this happen, along with our administrative officers and other supporting staff. So, these stalwarts have played a very integral role in the growth of MRHRU from seed to roots to flourishing branches, and each one has nurtured the growth and they have left behind a strong legacy by taking the crucial steps towards achievement of MRHRU's vision of healthier rural and tribal communities. So I once again request you to give a big round of applause for their immense contribution. Thank you, everyone. So just to conclude the formal ceremony, I may invite now Dr. Kiran Munne to deliver a vote of thanks.
Yeah, before delivering the vote of thanks, I would like to welcome Dr. Digant Amte and Dr. Anaga Amte, who have just joined with me. They have worked immensely in tribal district of Gadchiroli in Hemalkasi. Hemalkasi. Yeah, respected dignitaries, colleagues, and dear friends, it is my proud privilege to extend the vote of thanks on behalf of the organizing committee for this Decennial Celebration at MRHRU Dahanu. We now express our appreciation to Dr. Indurani Jakhar, who is the district collector, Palghar, for her gracious presence and motivating address that have strengthened our resolve to work closely with the health system and community. We owe our sincere gratitude to Dr. V.M. Kotal sir, the former Secretary DHI and DGICMR, whose vision and pioneering efforts led to establishment of MRHRUs and paved the way to strengthening of community-based health research in India. We are deeply grateful to DG Dr. Rajiv Bahel sir for his constant guidance and inspiring leadership in strengthening health research across the country. And our sincere thanks to Dr. Sanghamitra Patti, who is additional DG ICMR, for a valuable support. We are thankful to hand mic.
Hand mic, hand mic.
तो hand mic देना.
Hand mic भी लगी.
Okay. So we are thankful to Dr. Nitin Ambadekar sir. Yeah. Director Health Services Maharashtra for facilitating our research work in this state, and our heartfelt thanks to Dr. Gitanjali. I will not repeat the case which we have already felicitated here. So now I will thank our heartfelt.
Hello, hello, hello,
Presenting the
hello, 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 hello. Sound भी करना. Hello, hello, hello.
Santosh Chaudhary sir and the civil surgeon Dr. Maran. And
Hello, 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 hello.
also we are grateful. And the medical superintendents, Dr. Himmi.
Hello, 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 hello.
We are thankful to them. And now, faculty and
Hello,
staff,
hello, hello, hello.
It is, you can join for high tea.
Downstairs.
Downstairs.
Downstairs or the request of the guys for that.
जेवढा आवाज येईल तेवढा चालू होईल.
hand mic
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा
पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल कुशल जल वितरंगा तव शुभ नाम तव जय गाथे जनगण मन जय 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 जय
Hey!
आपने तो क्यों नहीं बनाया?
बनाया फुल बनाया, देखना देखना इतना सही आवाज आ रहा है।
VLC का
फुल बड़ा है तो भी नहीं चल रहा, इतना साउंड कम साउंड फुल बड़ा देखना एक मिनट। वो महेंद्र को दे दो। अरे मैं फोन लावलेला अप डाऊन होतोय पॉवर डीसी वरती चालतो होतो आम्ही जाऊन सांगू ना। हेलो एक सेकंड
अभी वो हो गया बोला अभी मत
हाँ